I want to thank everybody for coming out today to hear our presentation on heart failure and diabetes. My name is Myra Westbrooks, and this is Lynn Peeler, and we are students in the BSN program at Gardner-Webb University. And we have been doing some community teaching projects throughout this semester, and this is going to be our presentation. So we want to thank everyone for coming. I'm going to let Lynn start with diabetes.
Good afternoon. I'm Lynn Peeler. I'm a Gardner-Webb BSN student taking online classes with Myra. This is part of a project that we put together to incorporate diabetes and CHF. And thank you all again for coming. First of all, what is diabetes and what causes it? Diabetes, which is often referred by physicians as diabetes mellitus, describes a group of metabolic diseases in which a person has high blood glucose or blood sugar, which is either because insulin production is inadequate or the body doesn't produce insulin properly, or both. Patients with high blood sugar will typically experience symptoms like frequent urination. They will become increasingly thirsty, very hungry. There's also two types of diabetes. Type 1 is when the body does not produce insulin at all. Some people may refer to this type as insulin-dependent diabetes, juvenile diabetes, or early onset. People usually develop type 1 before the age of 40 years old, often in early childhood or as teenagers. Type 1 is nowhere near as common as type 2. There's more people with type 2 than with type 1 diabetes. And approximately 10% of all diabetes cases are type 1. Patients with type 1 diabetes will need to take insulin injections for the rest of their life. What are some signs and symptoms of diabetes? Feeling excessively tired, unquenchable thirst, frequent urination, numbness or tingling in the feet and hands, changes in eyesight such as blurry vision, unexpected weight loss, increased infections or wounds that won't heal, and sometimes your breath may smell fruity. That's a sign of like ketoacidosis. Type 1 is treated with insulin injections, diet, exercise, and type 2 is usually treated with like tablets, exercise, vegetable diet, and sometimes insulin injections are required for type 2. What is type 2 diabetes? Type 2 diabetes is most commonly a form of diabetes that people usually develop around the age of 40 or so. It's when the body does not produce enough insulin or cells to ignore the insulin. Insulin is necessary for the body to be able to use glucose for energy. Some complications with diabetes is eye complications, such as retinopathies, glaucoma, food complications, like foot ulcers. Sometimes people can get gangrene, which require the foot to be amputated. Skin complications. People with diabetes are more prone to get skin infections and skin disorders. Heart problems, heart disease, high blood pressure, hearing loss, gum disease, ketoacidosis, which is an accumulation of ketone bodies and acid in the blood, neuropathies. So a stroke is very common with people with diabetes because the blood pressure. If you have blood pressure problems, it can lead to a stroke, and you're at more of a risk to get a stroke than a person who does not have diabetes. Infections and the healing of wounds take longer than someone who is non-diabetic. Approximately 90% of diabetes worldwide are type 2. Some people may be able to control their type 2 symptoms by losing weight. Overweight and obese people have much higher risk of developing type 2 diabetes compared to those who have healthy body weights. The risk of developing type 2 diabetes is also greater as we get older. Men whose testosterone levels are low have been found to have a higher risk of developing type 2 diabetes. Now I'll tell you about some foods that we can eat if you're diabetic. It's important to balance your diet and try not to skip meals. incorporate into at least 3 meals a day, and those who are on insulin should eat snacks and check your glucose regularly to make sure that your glucose is not too high to help manage your diet. But it's important to eat fruits, vegetables, lean proteins, high fiber foods, healthy foods, and drink lots of water. It's important for you to drink lots of water as a diabetic to help manage your glucose also. Myra, she's going to explain the CHF.
The reason we incorporated these two together is because if you have diabetes, you are a lot more likely to develop congestive heart failure. And lots of times the congestive heart failure does come with comorbidities where you do have your high blood pressure, your heart disease, the diabetes, kidney disease. All these can just act upon each other and make things a whole lot worse. First of all, what is heart failure? Many people are confused about what heart failure actually means. It does not mean that your heart has stopped or that your heart is about to stop working. What it means is that your heart's not pumping enough blood to meet your body's needs. You may feel tired and weak. You may experience swelling in your legs, your feet, your abdomen, fluid in your lungs, and weight gain, and you may feel short of breath. Lots of times, things that will bring people to the doctor to start up with for heart failure is that they notice that they're becoming short of breath just in doing simple daily things that should not cause them to be short of breath. Things that can cause your heart failure and things that make your heart weak so that it can't pump blood can be your coronary artery disease, which is the most common. A previous heart attack, which some people may be aware they've had a heart attack, some people may not be aware. High blood pressure, heart valve damage or disease, infection of the heart muscle, alcohol abuse or heavy drinking, and sometimes other unknown causes can even cause heart failure. When at all possible, if your doctor can tell you what causes your heart failure, it's important that you know exactly that I've had a heart attack and that's why I have congestive heart failure. Because whatever caused your heart failure is what you need to focus on for the management of the heart failure. If you have high blood pressure, they would want you to be on some kind of high blood pressure medicine, and if that's your main issue that is causing you to go into heart failure. Heart failure is serious and there usually is no cure for it, but you can take control and you can manage the symptoms and live well and live strong. And you're not alone. 5.8 million people in the United States alone have heart failure. How do you manage your heart failure? First thing you need to do is if you smoke, you need to quit. You need to take your medication every day as ordered by your physician. Weigh yourself daily and keep a record of your weight. Report early signs and symptoms to your doctor, which we're going to go over what some worsening symptoms would be. Make and keep and follow up appointments with your physician. Eat a healthy, low-salt diet. You need to stay active and get regular exercise. Limit your fluids. And the main thing about your medication is that even if you feel like you're okay, then you need to be sure that you still take your medication exactly as your doctor ordered. Managing your medications. Your doctor may prescribe several different kinds of medications for you to take. You may be taking a medication to lower your blood pressure, and this makes it easier for your heart to pump and improves your blood flow. You may be asked to take a diuretic, which is sometimes called a water pill, and this helps your body to get rid of that excess water and reduces swelling and shortness of breath. And one thing to remember with your diuretics is that you need to adjust your schedule. You don't want to take this right before you go to bed at night, because if you do, you're going to be up going to the bathroom all night long. And for somebody who might work third shift, you wouldn't want to take it till in the morning when you come in. You wouldn't want to take it in the morning when you come in because you don't want to have to be up during the day taking it. So you need to kind of work with your medication and adjust your schedule. The most important thing is that whatever your doctor puts you on, you need to be sure you're taking that medication and taking it regularly. Follow your routine. Always talk with your doctor or pharmacist before you take anything that's over the counter to be sure that it doesn't interact with your medication. You need to carry a list of your medications with you at all times, and don't stop taking your medication unless the doctor says for some reason that you can. For your diet, the doctor will probably have you sit down with a dietitian who will go over in detail with you what you need to eat for a low-salt diet. But you just mainly need to remember that you need to eat less salt. Take the salt shaker off the table. You can season your food with pepper, lemon, garlic, or onion to add flavor. Keep in mind that all kind of processed foods can be high in salt. Read the label. get used to looking at the milligrams of sodium that is on the label, because generally if you're on a low salt diet, they want you under 2,000 milligrams a day. If for some reason that you're told to limit your fluid, you need to remember that fluid can count as all kind of things that melt at room temperature or melt in your mouth, and that would be like Jello, popsicles, soups, water, any kind of beverage, and you need to count those as liquids. What are some foods that are high in sodium? Well, that would be your fast foods, and generally any kind of fast foods is going to be high in sodium. Canned foods and soups, vegetable juices, frozen dinners, and that includes all these that are supposed to be healthy for you, like your lean cuisine and your healthy choice and all this kind of stuff. When you look at the back of them, they're just packed full of sodium. Salt cured or smoked meats like your bacon, your sausage, your cold cuts, and even salad dressings, soy sauces, ketchup, and your salted butter and margarine. Some things that are best to eat would be your bread and cereal and rice, fruits and vegetables. If you should use canned vegetables instead of fresh vegetables, you need to be sure that you're washing them and rinsing them with water before you use that, and that will decrease some of the salt. Low sodium cheese, fresh or frozen meat that's cooked without salt. These kind of things are things that you could use that would be low in sodium. It's important to remember to exercise, which some people say, okay, I have congestive heart failure and I'm weak, I can't get up, I can't do things that I used to. But just staying a little bit active is what you need to do, because activity increases your heart and makes your heart work more properly. You should plan your activities, stop and rest if you feel tired, learn your limits. You will have good days and bad days. And if you need help, ask your doctor to help plan an activity guide for you. If at any time you experience chest pain, arm pain, or heaviness or pressure in your chest, neck, or jaw, then you have trouble catching your breath, then you need to stop and call your doctor immediately. So what are some things that you need to do to be able to live well and live strong? Just to recap, you need to take your medication as ordered, lower your salt intake, stay active. If you smoke, quit. Avoid alcohol. Weigh yourself daily and take action if your weight goes up. Keep daily track of how you're doing and reduce your stress level. So if you're doing your daily things and you weigh yourself and for some reason you've gained 2 or 3 pounds overnight, then you need to call your doctor immediately. If you gain 5 pounds in a week, call your doctor. If you have increased cough, increased swelling of the legs or feet, increased shortness of breath, chest pain, discomfort, wheezing or chest tightness, confusion, dizziness, feeling faint, or if you notice over a period of a week or so that all of a sudden you're having to sleep on 2 or more pillows to be able to be comfortable at night. If your heartbeat feels funny, any of these symptoms, you need to call the doctor immediately, because you want to catch that stuff early and be able to get things taken care of before you end up in the hospital with bad problems.
Any questions?
I have one. If I became a diabetic, say type 2, that's the one that you require after age 40, right? And you said people can take pills and then some take shots. What could assure that I wouldn't have to take the shot, that I could be on the pills? What?
But type 2, you can really be any age. Some people, it seems like more can get it after age 40 than the type 1. But anyone can get diabetes, and usually any age. But with your question, the main thing is being compliant with your diet, exercising at least 3 days a week if possible for 30 minutes each time, taking your medication as prescribed by the physician. Don't skip any meals. If you have a high blood glucose and you're checking it regular and it seems to continue to stay high, make sure you call your doctor, because maybe your insulin needs to be adjusted. If you're on insulin or if you're on medication, he may need to change the medication or increase it. And then again, if it's too low, your sugar's dropping too low and you start feeling really sick and nauseous or really feeling bad for the medication, call him also, because it may need that you need to drop the dosage of the medication. But being compliant is a really big issue with diabetes, because the compliance can lead to type 1, which will require you to take insulin. And some people can come off of insulin. I've seen it happen, but it is rare. a lot of complications come from not being compliant. We put a board together just to show you some issues with diabetes. And the main thing is neuropathies. You have numbness and tingling in your feet, and sometimes you can't feel that you step on a sharp object, and may not even know you have a sore on your foot for a while, especially in the elderly population who don't check their feet regular, or they may think it's just part of the aging process, but it really severe wounds. And some people, it even leads to amputation of the foot or the entire limb, maybe fingers or toes at times. And also with heart failure, we incorporate the board just to make sure that you weigh yourself daily, because the weight gain, a 3 to 5 pound weight gain overnight is way too much, and that means you probably have a complication going on that you're not aware of. But yes, ma'am, you can take insulin even if you're type 2, if you're not managing your diabetes properly.
Generally, your diabetes, you may start eating now just a diet, and diet may manage it alone. And then as you progress, or as your disease progresses, if you need to go into other things, is the oral medications and insulin. It just depends on how your body adjusts to what treatments you're getting and how compliant you are. Any other questions?
I have a question. Both of you were talking about how important the diet was. So how important, or can you list any of the foods that I should avoid from getting diabetes?
Well, the main thing is diet, and to not really to diet. Don't avoid things you like, just eat it in moderation. But some foods that are bad for you are foods that are high in sugar, high in salt. Eat them in moderation. Canned foods are really high in salt, like canned soups, canned vegetables. Fresh foods are better for people than canned foods. And if you do eat canned foods, wash them before you cook them and prepare them, because it does have to wash some of the salt that's where they've sit in the can, but still there's a chance that it's still higher. You're not going to get all the salt off of it, but that's just one suggestion. If you really like canned foods and you know you're not prone to eat the fresh fruits and vegetables, but just remember, check the salt content on the back. And processed foods.
With this being the South, and all of us like salt and sugar and all that good stuff to season our foods with.
So fried foods are bad too?
Yeah. Yeah. You can use the lemon pepper, you can use regular pepper, you can use Mrs. Dash. There's many different things that you can use to be able to season your food, although it might not taste exactly the way it did. Just think that it's better for your body and for your condition.
One thing that we wanted to mention, on the brochures that we gave out, there's some resources on the back for community resources for people who are local here in Gaffney. If you can't afford your diabetic supplies, there's a place called Iron City Ministries in Blacksburg that's supported by the government, government funding. They will help you once a year to help you buy your insulin or supplies needed. And also, Buford Street has a Good Home Medical drugstore there that they'll be really willing to help you get your supplies and make sure you have everything you need. It just has a big variety compared to some of the other locations here in Gaffney. Also, there's some, if you have access to a computer, there's a website called www.myplate.com that you can actually go in and plug in what you like to eat, and it will kind of guide you to what you should and should not eat, and show you how many carbohydrates and proteins and things like that that are in your diet, and help you manage and set up a meal to actually 3 meals a day if you want. If you need help with preparing your meal and just making sure that you're not overeating starches at each meal or too many sugars. So a computer's a good access right now, because there's a lot of things online. There's diabetes, a lot of diabetic education that you can actually learn a lot from about the disease process.
And your physician can also make you an appointment with the dietitian here at the local hospital, who will sit down with you and actually make out a diet for you and tell you what you need to eat. And we also have a diabetic educator, Rebecca Ledbetter, who actually we've been working with on this project, and she sits down with you and tells you how to manage your diabetes, and does a lot of the diabetic instructs when you first get diagnosed with that, and is a very good resource. So
the main thing is checking your blood sugars and making sure they're not too high or too low, and trying to maintain the diet and exercise, and also with congestive heart failure.
Any other questions?
if I have diabetes, how likely am I to get heart failure?
You are at a bigger risk.
Yes, your risk doubles actually. People with diabetes are prone to get other diseases, especially heart failure, heart attacks, and strokes, twice as likely than someone without diabetes.
So it's very important that you manage your diabetes.
Anything else? Well, thank y'all for allowing us to present this for Gardner Webb, and we appreciate it.
Thank you.
again.